Eva, Lindsay, and I decided, and Stephanie, who is our camera person, she's our cinematographer for the day, have decided that we're going to put together a quick palpation video to cover all of the palpations that you will be tested on Thursday the 28th. That's the date on Thursday. Before we demonstrate or go through those palpations, I want you to hear a few rules about A&P and taking exams in A&P. Rule number 1, no abbreviations. Do the best you can to spell the words correctly if you have to write them out, but don't use abbreviations. So your acromioclavicular joint is just that. It is not the AC joint. So spell everything out, no abbreviations, no matter how badly you want to use the abbreviation. You get there, right now it's time to learn to internalize what all of those abbreviations mean and use them correctly. The next rule is when you are taking a lab skills exam, a quiz, or a practical where you have to label structures, use the actual anatomical name of the joint. So it's not the shoulder anymore in your brains, it is the glenohumeral joint. And you will write that out because we're not using abbreviations. So anatomical terminology, accurate anatomical terminology, spelling I'm pretty generous on. As long as you misspell the correct answer, you'll get credit for it. If you spell correctly the wrong answer, you're not going to get credit for it, okay? So no abbreviations and use anatomical terminology. All right, without further ado, we are going to start with the palpations on your lab guide. The first one is the clavicle. And come on up, Eva. So remember the 3 fingers, your Scout's honor. No lonely hands. Give a stabilizing hand. Put those fingers on, generally, we're going to say skin. We're not palpating over clothing. All 3 fingers at this point are on the clavicle, so I don't have to lift any of my fingers off. I can simply say, this is the clavicle. All right, palpation number 1. The next group of palpations is the scapula. So I'm going to have you turn. And so you can see Eva's scapula. I'm going to tuck your shirt in just a little bit, just to allow a little bit more visualization. So remember that you're going to use your eyes first, and then use your hands to verify. So here's my not lonely hand. I can see the inferior angle of her scapula, but I'm still going to use the palpation technique and use the web space to verify that. Then I have to remove all additional palpation and point out the inferior angle of the scapula. I go back to that position. If you would please put your hand, yeah, and then just try to relax your shoulder. Now you can see how prominent the inferior angle is, but you can also see that the scapula has downwardly rotated. So now the inferior angle has moved towards the spine a little bit. So I have to move my hand to find the lateral border. So I remember I'm going to squeeze the angle between my thumb and my index finger and find that lateral border, and that is the lateral border of Eva's scapula. The medial border is right here. That's the medial border of the scapula. If I leave my hand on her back and say, that's the medial border of the scapula, Eva can't tell what I'm talking about because all she feels is my hand on her back. Your instructors are no different. So you have to isolate the structure that you are supposed to find and tell us what structure you think you're on. And hopefully you're accurate, okay? So there's the medial border, the lateral border, and the inferior angle of the scapula. The next is the spine of the scapula. It's a very similar palpation to clavicle. That 3 fingers find the ridge. That is the spine of the scapula. All right, you can go ahead and relax your arm. I'm gonna have you turn kind of at an angle. There we go. So for the acromion, you can see Eva's clavicle, and there's the acromial end of her clavicle. So the acromion is going to, be right beside that. You want to be on the flat table-like surface of the acromion when you say, this is the acromion of the scapula. Another rule regarding exams, if you label a bony prominence, if the name of the bone is not included in the name of the bony prominence, you have to add it. So the acromion doesn't tell me what bone that prominence is on. I would have to write the acromion of the scapula. If I had you label something like the radial tuberosity, well, the radial tuberosity is on the radius. So if you just write radial tuberosity, then I know that you know it's on the radius because it's the radial tuberosity. All right, so that's the acromion. So while she is here, we'll do the sternoclavicular joint and the acromioclavicular joint. So the sternoclavicular joint is the joint that occurs, let's look at the skeleton first. At the manubrium and the clavicle. If I put my fingers on the sternal end of the clavicle and say this is the sternoclavicular joint, I'm incorrect because what you're actually on is just the clavicle. If I put my fingers on the manubrium and say I'm on the sternoclavicular joint, I'm not correct. A joint or an articulation has two bones involved. So you need to be in the space between the bones, and that is easier to find if you've got two fingers. So then you would put two fingers so that you can actually feel the two articulating bones. Sometimes you will be able to feel the space between. If you can feel the space between, even better. That is actually the sternoclavicular joint. Acromioclavicular joint, as you have noticed in class, varies from person to person. Some individuals, their clavicle is level with the acromion, and you don't have the little drop off like we were able to see on Eva's acromioclavicular joint. Some, the clavicle is slightly elevated, and it's much easier to visualize. Follow the acromial end of the clavicle until you feel the space between the acromion and the clavicle, and that is the acromioclavicular joint. So Lindsay, come on over. All right, so use your eyes first, and there is a little elevation right here. So I know that this little elevation is close to the acromial end of her clavicle. I'm going to find that. I can actually feel the joint space right here of the acromioclavicular joint. And then what I can have Lindsay do is move her shoulder a little bit. I like abduction. It's easier for me to feel an abduction. Some of you like flexion. That's fine too. What I'm aiming at is that you actually feel that articulation move. So there is your acromioclavicular joint. Here is the space right there between her clavicle and her sternum. For this one, I find it easier with either retraction and protraction. Some find it easier with elevation and depression. So you can shrug your shoulder, and let them drop. And that's it. I can feel those two bones move against each other. So that is the sternoclavicular joint. Coracoid process of the scapula. Remember, we'll show you here on, I don't know, should we call him Bernie? Since Daniel mentioned Weekend at Bernie's yesterday during lab. About an inch below the the acromial end of the clavicle is the acromion process. Is the coracoid process. Hurts, man. The more you say in a row, the harder it is to be accurate, I think. All right, back over. So you can find the clavicle and then drop into the soft tissue just below the clavicle, and then take up that tissue until you reach a bony prominence or a stop, and that is the coracoid process of Lindsay's scapula. The other way I showed you is to put your palm of your hand on deltoid and then rest your thumb just below the clavicle and take up that soft tissue. And there is the coracoid process of Lindsay's scapula. All right, so we just did clavicle, lateral medial border of the scapula, inferior angle, spine of the scapula, acromion, coracoid process, sternoclavicular and acromioclavicular joints. And how many minutes have we been recording?
Almost 10.
Almost 10. And that doesn't include all the yapping that I'm doing. So we got through a lot in a short period of time. So the humerus. the greater tubercle and the lesser tubercle of the humerus. Bring back Bernie. So if you follow from the acromion, you drop down onto the lateral aspect of the humerus, you will be on the greater tubercle of the humerus. If you put your flat fingers against the anterior arm of your subject and then internally and externally rotate, you can see how you would feel two hills and a valley. The one more lateral is greater tubercle. The one more medial is lesser tubercle. If you externally rotate too far, you will fall off of the lesser tubercle. And there is a little valley there, but that is not the intertubercular groove, so you will be incorrect. What you want is the tendon, where the tendon, long head tendon of the biceps brachii lives, and that's why you do your salient sign. So this is what this looks like. Don't mind, I'll move you around by your sacrum. Come on. All right. So I'm going to use flat fingers against the anterior aspect. My forearm, so if you can turn to your side so they can see, I use my forearm to stabilize the scapula and her shoulder. So if I just put my fingers here and pull on her, it doesn't feel balanced to her. So if I put my arm against her, the posterior aspect of her shoulder, then I can put pressure through the front of her humerus without her moving. You can relax, I'll do the work. And then I'm going to externally rotate and internally rotate. And notice that I didn't externally rotate. Just a little bit of motion. And then I'm gonna move my fingers little bits at a time. There's not a lot of, the more I move my fingers, the less likely it is that I'm actually gonna feel what I want to feel. So here is the intertubercular groove. This is the greater tubercle, that is the lesser tubercle. So I'm going to verify that I'm in the right place by saying, don't let me move you. And then I can feel the tension in biceps tendon. So that is a way to verify that I'm actually got my finger in the intertubercular groove or over the long head tendon of the biceps. So then I know that that is lesser tubercle and greater tubercle. So that was 3 of the humerus palpations. Deltoid tubercle, remember deltoid, the origin is what, Lindsay?
The lateral 1/3 of the clavicle, acromion, and spine of the scapula.
Okay, what's its insertion?
Deltoid tuberosity.
Deltoid tuberosity. So that muscle, which it looks to me like half a pumpkin, right? The half a pumpkin sits right on your shoulder and inserts right down there on the deltoid tuberosity. So this is the one where you're going to feel for the elevation in the bone. And there it is right there. So that is Lindsay's deltoid tuberosity. Medial and lateral epicondyle. If you have your subject with the elbow flexed and shoulder relaxed, you're going to use the outside of the humerus for the lateral epicondyle. So you're going to go lateral until you feel it, the sharp, relatively sharp elevation. That is the lateral epicondyle of the humerus. Medial, let's turn you this way just a little bit. Same thing. Go down the medial aspect of the humerus until you find the elevation that feels like marble size. That is the medial epicondyle. The medial epicondyle of the humerus feels a little posterior compared to the lateral. So if you look at Bernie here, a lot of the reason that is because we all have sort of forward rounded shoulders. But you can see that we also don't stand in true anatomical position where those two prominences would be parallel to each other. So they are a little bit off, well, they are parallel, but a little bit off at an angle as opposed to straight forward. Those are your humerus palpations. That leaves the muscles. Muscle palpations are deltoid. So I'm going to find deltoid by having you hold your arm right there. Okay, so go ahead and relax for just a second. I'm going to put my fingers gently on deltoid. Hold your arm there. Don't let me move you. And then you can feel the tension in deltoid. That is the muscle belly for the deltoid. Biceps brachii. You can already see, so I'm going to kind of put my fingers around the belly of biceps brachii. Don't let me move you. And then as it contracts, I can say that is the muscle belly of biceps brachii. Triceps. Here. Now this time what I want you to do is hold your arm right there. Don't let me move you. I'm going to actually try to push her into elbow flexion. She will contract triceps. That is the muscle belly for triceps. Then we have, and here's a correction maybe some of you didn't hear. The only palpation for rotator cuff muscles is the tendon of supraspinatus. Infraspinatus is not a palpation. That's an error on my part. So supraspinatus tendon, if you remember the sits muscles, you remember S is for supraspinatus. It inserts right on top of the greater tubercle of the humerus. Right behind that is infraspinatus teres minor. And then underneath, in the front of the arm, is subscapularis. So we're going to find the tendon of supraspinatus. What I want you to do is move your arm out to here and then drop it like a wet noodle and do that about 5 times. Again, one more time. And there is the tendon for supraspinatus. And Eva, what's the origin of supraspinatus? Yes, she said the supraspinatus fossa. So we're good. So the last palpation is the long head tendon of biceps, and that is the same as the intertubercular groove of the humerus with the same salient sign. So you have all of your palpations. You have more words to listen to than you probably hoped for, but hopefully this will help you prepare for Thursday. We'll take a little bit of time to practice before we actually do the palpation exam. So we'll see you soon.